Speaker, my question is to the Minister of Health. Today, I sent a letter to you, Minister, which asks for your support for Bill 60, my private member's bill, the Safe and Healthy Communities Act, ending gun violence. When I first tabled this bill, your government said if the bill has merit that you would support it. Right now, there are students in the GTA who are reeling from the trauma invoked by gun violence. My riding of Scarborough-Guildwood has already this year seen 10 shootings, including one fatality. We're mourning the loss of Jeremiah Robinson, an 18-year-old student who was gunned down inside of his school. I visited this school. I talked to parents, students, the principal, even the custodian staff. And they believe that this bill has merit and that we need to do more. Speaker, Bill 60 would provide trauma-informed counseling paid for by OHIP, a service that this school and its parents and students agree are needed right now. Will the minister work with me on Bill 60 so that we can get these much-needed services and help to the people in our community who are suffering as a result of this type of violence that is affecting their community? This bill has merit, and I ask for your support for this.
Thank you. And to reply, the Associate Minister of Mental Health and Addictions.
Thank you, Mr. Speaker, and thank you for that question. We all know that in the province of Ontario, especially given the opioid crisis and the pandemic and everything that we've been seeing, that there is a great need of support, especially for our children and youth. And our government, Mr. Speaker, has invested in children and youth mental health. We invested over $31 million in new annualized funding this year to improve access to specialized mental health treatment services, to reduce wait lists and wait times, and support the mental health and well-being of children and youth. And this includes an investment of $20 million for an across-the-board 5% fund increase for all government-funded children and youth mental health agencies. In addition to that, $2.7 million for 4 new youth wellness hubs across the province of Ontario, in Guelph, in Renfrew, in Timmins, and Windsor. In addition to that, through the Addiction Fund, Recovery Fund, we're also making additional investments in children and youth wellness hubs so that we can support our children and youth and build resiliency in them. Thank you.
And a supplementary question.
I certainly support the investment in youth mental health. I asked this government to reinstate the $25 million that was cut from the Education Other budget, which supported after-school programs such as Focus on Youth, which was directed towards vulnerable youth at risk of violence. These programs need to be reinstated. They need to be reinstated now. There are 43% increases in shootings in my riding alone for year to date. There are more shootings than there are days in the week. In the year. By meeting with young people, with their families, one of the questions that the young people asked is anyone listening to us? Are we actually hearing the young people when they say that they need help and they need that help now? Programs for youth need to be funded. And the cuts that were made early on in this mandate need to be reinstated. So,
question.
Bill 60 is offering an immediate solution. Minister, and back to you, Minister of Health. You did talk about funding counseling services digitally, and I'm asking for that to be done now, and so are the families and the young people affected by gun violence.
To reply, the Associate Minister.
Thank you, Mr. Speaker. And once again, I'd like to reiterate our position is to ensure that we provide youth and children the supports they need where and when they need them. And we have made significant investments and will continue investing in our children and youth by providing them opportunities to have their youth, their mental health looked after. The youth wellness hubs, for instance, the ones that I visited around the province, the investments that we've made through SAPACY to provide specific resources for young people so that they have safe spaces where they can be comfortable and receive culturally appropriate services. Mr. Speaker, we are looking to ensure that young people have the resources they need so that we can prevent, so that we can build resiliency, so that we can further educate. Because we know that children are our future, and this government has taken that very seriously, making investments that now total over $525 million a year in new investments to ensure that we look after advocating for our youth and providing the supports they need, and also building treatment capacity to help those that are in greatest need. Our government takes...
Thank you. Thank you very much. The next question, the member for Kitchener-Conestoga.